we were told it was a fluke. We're like, total fluke. It was random. Should never happen again. So we're like, all right, cool. Let's have another kid. So we got pregnant again, and round 2 was even tougher. More sickness, more in and out of the hospital, more throwing up, more trying to balance like the diabetes aspect. Because if you think about it, she would eat food, and as a diabetic, we'd have to substitute with insulin. But then she'd throw up. But she had all this insulin on board, but no more food.
Oh, interesting. Yeah.
Or we waited to see, are you going to keep it down? If she kept it down, now her blood sugars are through the roof, and we're chasing them.
Right.
It's kind of like this conundrum of like, how are we attacking this? Plus, in and out of the hospital. We're in the southeastern corner of Washington, and there was a few times she got sent up to University of Washington in Seattle, just 4 hours away, because they have a perinatal unit and more equipped to handle the higher level of care that she needed. More PICC lines, central line, a whole bunch of different things. And Colby was born at 36 weeks. So she was another 4 weeks. And when she was born was when we found out all the problems, right? Because I remember sitting in our OB-GYN's office, wonderful man, I love him, getting a biophysical profile. And that's when they do an ultrasound of the uterus to see the baby, to see all the movements. The baby needs to move all the limbs. They need to like show that they're breathing. They need to do different things to pass in a certain amount of time. And we were told Colby passed. And so in our brains, because, okay, she passed, she's fine, right? Quote unquote. Less than a week later, she's born, and we find out she's not fine. At that time, she was intubated very quickly. And through the course of events, we found out that her brain was small. Like, it was fully developed. Lobes, hemispheres, everything was fully developed, but it was small. So inside her room, we were talking to a pediatric neurologist, and he's like, it's very interesting because in her brain, inside of her head, there's enough room for her brain to be about the size of a softball, but it's the size of a baseball. Wow. It's just small. More things and more things. Basically what it came down to, I mean, she had like holes in her heart, 2 or 3. Right. But I was like, we'll watch it and fix it later when she's 3 years old if it still needs to be. I mean, a whole bunch of things. What it came down to was she never developed that reptilian base level gag reflex. And that's what we need, because when we sleep and that saliva that we produce hits the back of our throat, our body does not wake us up to swallow. It's just a reptilian reflex. It just happens. And she never developed that, so she would drown. Wow. Because she had to be intubated. And so about 3 weeks of this, a little over 3 weeks, we sit down with a doctor, and he basically tells us we have 2 options. One, we can give Colby a trach, and she would breathe that way. That's how we would keep her lungs clear. A nurse would live with us 24 hours a day for the first while, and eventually they'd wean off to where maybe they were only with us 16 to 18 hours a day. She would just exist. At the time, not being a doctor or anything, I was like, you mean like a vegetable? And he's like, well, yeah, but we don't use that term for kids. Right. Because they were never not that way. So it's a different term. And that she would probably die in her mid-teens from an infection. Or we could remove her breathing tube and let her go. And so at 25 days of life, my wife and I, it was like, so think of Seattle, February 18th, right? You're thinking overcast skies, pouring rain, because this is Seattle, right? Right. It was one of the most beautiful days. Blue skies, a couple clouds here and there. Sun was out. It was cool because it was winter time. Right. But it was beautiful. And they let us go out onto the porch. And sorry, dude.
Yeah. Take your time.
Let's go out onto the porch and hold her while she passed away. And so, unbeknownst to us, the doctor was inside taking pictures through the door of us as we were just there. And so the next day, we came back to the hospital, and they had this whole box like for us, and they had taken like her handprint and her footprint and put it on this like glass heart Christmas tree ornament type thing. There was like some hair that they had cut off and a lock of hair for her, and just a whole bunch of cool things that they did for us. They included these pictures that the doctor took. Wonderful man. Dr. David Lauren, Seattle Children's. I don't know if he's still there or not, but to this day, I idolize that man.
Right.
So we went through that. Time passes, and our OB-GYN doctor said, okay, we know it's coming. You're going to get sick, but we can get ahead of it this time. So I can get you one more. It's pretty much all I can do. So my wife and I talked about it, and we said, okay, one more. And almost it was, wash, rinse, repeat, right? She got very, very sick, in and out of the hospital, PICC lines, had to use TPN for nutrition. But at 32 weeks, again, just like my son, our firstborn, Capri was born. And so she was our third. The doctor kind of looked at us and was like, you realize that if you have any more, you're going to die. So I'm in there getting, Capri out. You want me to close up shop? And we're like, yeah, let's close up shop. So for my wife's sake, for her overall health, we can't have any more kids.
Right.
Naturally, I mean, we can adopt and stuff like that, which we talked about. But so that's kind of the story.